The topics discussed and the information provided on this program is for general information. The hosts of this show are not medical professionals and are expressing their personal views and stories related to their individual lives. Their views are not intended to be used or taken as medical information. If you or a family member have suffered a traumatic brain injury, you should seek help from a practicing licensed physician.
You're getting ready to watch Brain Mechanics. It's brought to you by a severe brain injured survivor. But you are your own brain mechanic. I'm my own brain mechanic. I have the wrenches. I know how to put in the fuel. You also are the operator of you. Do we need specialists? Sometimes it's more than changing a tire. But you need to keep alert, listen to your body, go the proper speeds, and always check your air pressure. Look in the mirror. Remember, you're going forward and hit the road.
Hi, I am Matthew Duffin from downtown Milton, Indiana. This is Brain Mechanics. And January 2021. We're not off to a good start, but it'll get better. I hope. I pray. But I don't want this show to be about the insightful riots or the counterterrorism or any of that. We all know where America is right now. My moment in peace and quiet. Because I've been dead on arrival before in my life. In fact, 11 times. I was brain dead after a motorbike accident. Scooter. I was brain dead. I'd been drilled through my center of my skull twice. Center of my brain. Oddly. Kills most people on impact, or a lot. My family was called in. They hung out for 7 days. They pulled the plug on me. I became one of Dr. Scott Bierke, who is a tremendous neurosurgeon. I became one of his miracles. He brags about me. He brought interns in to show them off to me because I lived. I didn't know what any of it was about at the time. They sent me home. So I had a sister that told me I must have been healed. I'm a lot better now. They sent you home. I wasn't even sure what home was other than it looked kind of familiar. My head had been split. And then I had some really good speech therapists from Reed Hospital. They reconnected me back to Methodist and who reconnected me back to RHI, who reconnected me to RHI Outpatient. And lo and behold, there was Dr. Trexler and Dr. Backhaus, people that I had met when I was in the office or in the hospital. And here she is again. You know, I want to introduce her real quick because Dr. Samantha Backhaus, my hero, she picked up the pieces, the family pieces, the medical pieces, the knowledgeable pieces, the coping skill pieces, and slammed them all in my head in about a year, and took me a while to keep on learning, keep on studying, which is what you do. You got nothing else to do after a stroke or a brain injury. Work on it, slowly, baby steps. Hour here, hour there. Take a day off. They don't recommend that, but you do what you have to do to get through it. Because they give me Dr. Backhaus, and she works as a clinical neuropsychologist, and she specializes in treating patients with brain injury. She's the associate director of outpatient neuropsychology services through RHI, the Rehab Hospital of Indiana, my home school. Her primary role is as a clinician treating patients and family members. Somebody that works with family members that lets them understand that this is everybody's ball game, not just the patients. Y'all got tickets. She didn't say that, I did. But she's involved in research projects, of which BIX was one. They developed clinical interventions, and they conducted 2 big studies on the BIX training group, and they published papers on it. They were able to demonstrate the efficiency and the merit of that group helping other people deal with the effects of the injury. Since then, we've actually, I'm part of them, provided this intervention to people on a clinical basis. You can go out and see them, and you know, it's a half hour, 45 minutes away for a lifetime of treatment. They've traveled internationally. The BIX program, I know, has been up in New Zealand and India and some other places they've set traps for. And they're training the clinicians on these cultures. You know, they got one of the top doctors that there is in neuropsychology, and Dr. Hammond and Dr. Jim. I'll come up with it in a minute. Because I'm running on. This is how we do. You know, they're trying to get this in these workshops out to clinicians throughout the United States to a service that can provide many locations. They also got a program called Couples Care, which I never qualified for, that has done fantastic treatment with couples because, like family, the loved ones and the marriages seem to break up after brain injuries, just the way it is. And she's come up with a way to stop that, and it seems to work. So, time for me to shut down. I've done the best introduction I think I can do. Ladies and gentlemen, Dr. Sam Backhaus.
Hey. Hey, Matt.
Hey, doctor, how are you?
Good, thank you. How are you? And thank you for having me on your show. I've heard great things about it.
It's a show. We try to push it on and give brain injured people their own little David Letterman stupid guy. Hi. And we have fun with it. You know, you taught me a lot, so it's not like I'm not educated in some of this field to a degree. If I need to get an answer, I got plenty of phone calls I can make to people. So, you know, I'm not a doctor, I'm not a clinician. That's what they say at the beginning and the end of the show anyway. But, you know, I'm here to help. And
I'd like to say you're a professional of brain injury, though.
Yeah.
I mean,
there you go.
Sorry, but you're a professional. You know better than any of us. So you're part of the team.
Yeah, that's one of them discussions that people come up to you and they say, I know what you're going through and I can understand what you're feeling. And well, when did you get your brain injury? How do you know? But you understand somewhat because you've been around so many people for so long. What, 18 years you've been in this field? How's that make you feel? 13 of them with me. No, but the programs and the things that you run through out there, it was astounding to me. You know, when Joni Goins first sent me out to Indianapolis and I went to the conference and looked around and talked to people, and I realized that there was a whole world out there to see and enjoy somewhat and to grab back. And you presented me the ways of doing that. You know, coping skills have been a dramatic change in my life. Better than any drug, well, maybe not a painkiller, but better than any drug I ever took or had to take. Are you okay?
Oh, I'm great. I'm enthralled by your story and, you know, your description of the event, so.
Well, I know you've been through so many people. I'm sure that story that you've long forgot, and you've been through a lot with me. 29 surgeries. You were around for most of those. Anyway, you know, I'd like to talk a little bit at first because you and Dr. Ibarra took over Dr. Jim Malik's program that he was helping to research develop. And you started this brain injury coping skills project right there in uptown Indianapolis. And again, it's going across the world and people are recovering and doing well. There's books from Lash Publishing for the brain injury coping skills. You know, it's a great book to get. It's like $40 for $5,000 worth of information at one time. And you have to work it with somebody. Myself, I have a lot of books. I got a filing cabinet full of books. And I even got a new one. But I know I met Summer right before she was a doctor, and you guys had worked so hard on this project, met so many people with conditions I don't know if you guys realized at a time. You know, I had one buddy that got hit with an electric wire in his head, and it sparked a big blowout of the back of his skull. And he made it. I think it was 10,000 voltage or something. He was a construction worker, and I watched her help put him back together. I watched brain injury coping skills put veterans' lives back together to where the government couldn't. Do you take on a different type of work or all the same work when you're working with these different types of people from different walks of life? I mean, you've had people that's been in accidents that's killed people. That's, you know, people that go into church that got hurt coming out of church, you know, from up and down because it happens and people don't realize it happens. So what would your thoughts be on that? The different variety.
So Matt, specify, or if you can repeat that question, because you talked about different types of people, right? That different individuals from all walks of life having, and so what was the specific question that you had wanted my opinion on?
What a workload. Because you know, I've talked to several people through the air. What a massive workload. See, there's some part of the training I don't understand. But, you know, how do you not take that home with you? And I know you got 3 beautiful boys, and I guess your husband's okay looking, but no, I'm saying hi to everybody. I know him too. You know, how do you go to supper with all that on your plate?
How do you not take it home with you? Wow, that's a really loaded question. And so if I find the right answers to that, I will absolutely let you know. But right now, I don't have the right answers. I think that, I don't know about right answer being, I don't have a great answer other than to say, I don't know that I don't bring it home. I think for many, many years I did. And, you know, I'm going to assume I can speak for many clinicians who are dedicated to this field. So I'll use we. But I think many of us do take it home and we do take it to heart. A brain injury, they call it an invisible injury, right? Because you don't always know that it has happened to the person, right? There isn't always going to be some observable physical sign, and it happens to anybody at any time in so many different varieties. And so it's humanity, right? Like there isn't like one type of person that this happens to. It's humanity, and so I think that really touches you. You know, as a clinician, from this perspective, that every single person that walks into your office, there is an appreciation for, you know, of who they are and where they came from. And it's not a one-time treatment. It's not in 8 weeks, your ankle's going to be better and you can start running on it again. Like, you know, it's a lifelong condition for many people. And so. And
I didn't believe you all.
What?
I didn't believe you guys when you told me that it was going to be lifelong. You're right. I'm sorry.
Sure.
You're right.
Right. And I guess that goes home with you because it's never enough, right? Every person's different, every story, everybody has touched a piece of your heart in some way. And I think that it definitely, the fact that you, as a clinician, you can only do so much within the confines, within the domains of what your specialty is, your knowledge base. So many factors will influence, right, how that person heals. So yeah, it's a good question, Matt. I don't really know that I ever stop bringing that home because you care, right? You're just going to care. And at the same time, I think at some point, you're right, like doing this, I think if you're going to try to be effective and help other people, you're going to need to take some self-preservation. So yeah, I think at some point we need to use strategies to take care of ourselves and find ways to separate ourselves when we get home. So.
Okay. I know you as a doctor and, you know, as a caring doctor that understood that, you know, we'd have 14 people in our BICS classes, and they would last 12 to 18 weeks, 20. And it seems like you was part of all of us at the same time. That's where that question came from.
Sure. Well, you connect, right? I think that's the nice part is that we all connect with each other.
Yeah, for 2 hours a week or an hour a week, whatever it goes down to. It. Interesting. course, when you got an hour ride to Indianapolis and back, you got all kinds of time to think and study. Anyway.
Yeah.
I know they do a lot of clinic studies at RHI. Are you aware of any now that people, stroke victims, or I know it's other people to talk to. I just didn't know if you was aware of any. Or
Of studies going on at RHI, you mean, or?
Yeah, through the pandemic and all that. And I mean, people are still getting brain injuries. They still got to go, and families still got to deal with them.
Absolutely, absolutely. I mean, yes, long story short, we are still running many studies at RHI, and some of them are medication related, right? Some helping with irritability or memory or different types of issues. Some of them are very intervention related. So, going through different types of intervention to manage anger or manage our perspectives, the way that we can shift our perspective or view of the world so that we can, people can learn to manage their irritability or sort of hostility, that people might tend to feel. And so, yeah, we have many different types of those studies going on, from medication to intervention, but then also we're reaching beyond just the individuals that have already come for treatment. They're now reaching out to people in the criminal justice system and trying to actually implement things like BICS or things like the ICANN intervention, which is I can change my negative attributions, right? So it kind of helps with anger. So like they're trying to implement different types of intervention programs to those with a brain injury who have been arrested and like who are in the prison system or who are getting ready to be released from the prison system, so that they can help reduce the rate of recidivism and help them reintegrate. They're trying to help people with domestic violence, right? So people that have had injuries and deal with coping skills and other types of interventions that they do in those populations. And we're also studying these types of interventions that we've done personally. We're actually, running studies to look at how we can do telehealth. So they actually finished a study like on that BICS program, doing it telehealth. And, I think someone well, Claire, one of our other counselors here, and she actually ran that a lot, and Dr. Parrott led that study. I don't know if you know her, but so she actually led the entire study, and Claire ran the intervention, and they were able to look and see, would that intervention be helpful to reach out to people who cannot do that hour drive. And so, during COVID, that was a good time actually to be running that study.
Right. I know people in prisons, if they give it their all, if they actually sit and study and work, and there has to be some adjustments, I'm sure, for your conversations and how you want them done, but they will, Is their brain rejoining life? Kinda, but not like stroke victims or brain injured victims or, people that had massive trauma, or that's a different kind of comeback to life. But it's all learnable goals. I'd like to try to start teaching it a little bit, with your permission, around some of the local schools. I don't know how to go about it yet, and I'm not doing it right now, but
Sure.
I think it would be great, 8th grade, 9th grade year-old kids, I think. The ones growing and developing. And
yeah, like you said, you look to the specific population you're talking to, and coping skills are coping skills. You teach them and implement them to what's specific. And I think we've always felt that, starting at kind of late middle school and into high school,
right,
and even early college, right? Like people need those sort of kind of adolescent stress management skills so that they can make good decisions and start making those good decisions as they become independent in life, you know? So I think that's a great way to do.
Yeah, because, I know I went to class with, some of them were teenagers. It was an adult class, but some of them were late in their teenage years, I guess. And they had their parents or somebody with them, of course. You take somebody to Bix is how it works. But they were learning. There's a couple of them I'd stayed after and worked with a few weeks. I had a little different style, but they were doing the work finally. I don't know if you remember that or not, but.
Was this through the peer mentoring?
When we were starting the peer mentoring programs,
Mm-hmm.
You had a couple younger guys that were
Mm-hmm.
understanding but not doing the work, and their moms couldn't get through to them, and this, that, and the other. And actually, he called me up and had me come back out and see if I'd work with them, and I did, and
Yeah.
it was great. Now you're smiling. Now you remember it. But
Mm-hmm. Yeah.
that meant a lot to me personally to see their growth. Things like that's what made me want to help people on the radio to begin with.
Yeah.
I didn't want to be you, but I thought if I could get any kind of help out in the world like you do, that'd be one of my promises I made to God when I was laying there dead. So, here I am.
I think you have the ability to connect with people, Matt. I mean, you're a people person, and I think that one of the most critical elements in helping people, whether you're just sitting and letting them vent or whether you're trying to teach them specific coping skills is the ability to connect and try to relate. You don't necessarily have to go through exactly what they go through, but you do have the ability to connect with them. And I think that really made a difference in how you were able to help others. So.
And that's what we all respect, to be able to talk to somebody that understands us.
Mm-hmm.
Although you're one of the normals that understand us, and I'm getting Boo, my new caregiver, to understand a little bit. It's a different world. And I don't wish it on anybody. I wish the road to recovery would be with your way, your team, but build a team like I did, because I'm sitting here talking to you on the radio, on TV, and mostly because of Dr. Backhaus, after I lived, in her way of getting my mind back together. We're out of time for today. So why don't you join us next month as I continue a conversation with Dr. Backhaus.
The topics discussed and the information provided on this program is for general information. The hosts of this show are not medical professionals and are expressing their personal views and stories related to their individual lives. Their views are not intended to be used or taken as medical information. If you or a family member have suffered a traumatic brain injury, you should seek help from a practicing licensed physician.